afternoon. I'm Dr. Dimitris Dourakis, and I'm the Professor of Surgery and Vice Chair for the Department of Medicine. Now, I know that these last days you've been given a lot of information about how courses are going to run, how your life is going to be the next semester, and we're going to keep it simple. So for this presentation, we're going to discuss about where are you going to connect for your class, how are you going to have your online lectures, and how online labs are done. When you want to connect for your online classes, there are two simple ways. The first one is from the page of the European University Cyprus. You can click at My EUC Login, and you'll be directed to a web page where you have to give your credentials, your username and password. Otherwise, from your web browser, you can type directly myeuclogin.euc.ac.cy, and again you'll be directed to the main page where you log in for your courses. Here you'll be asked to give your email and your password. Both of these are supplied by the IT department during your enrollment. You need to know these because these are your keys in order to follow up your courses. Then you'll be welcome to the screen where all the software of the university is located. From there, keep in mind that all courses for the first year are delivered with a program called Moodle. So click on Moodle to go to your course selection screen. Once you arrive at the Moodle web page, you'll see that in this page we have all the courses for the university. So you need to scroll down until you are able to find the School of Medicine courses. So here you can see that we have highlighted School of Medicine and Fall 2020. This is your semester. So from there, inside Medicine program, you will be able to find the first year folder. So this is where you need to go to find all your courses. Once you click there, you will find a list of the semester courses. So from there, it's just a matter of selecting which course you want to enroll to, and once you're inside the course, you will need to give an enrollment key. This is a code that is given to you, again, by your instructor or by the school administrator, and this is required for you to be able to access the course. So these are the formalities. Once you do that, you will see that you will be able to enter inside the course screen. Okay, so this is a typical page showing how the courses are organized. You can see that the lectures and the labs are organized by week. So here you see that we have the different lectures and labs for the first week. With yellow, I've highlighted your lectures. Just by clicking there, you'll be able to go through the presentations. There you have your lab material. We'll come to that a little bit later. We will explain what you can access there and how you can prepare for the labs. And last but not least, since everything that is done online is recorded, you are able to go back and watch these recordings. So once a lecture or a lab has been delivered, you will be able to find the links to the recordings on the Moodle webpage, and from there you will be able to go back and review all this material. This is a great way to revise or study things that you might not have understood correctly during the online sessions. Another important source of information is the course outline that you can see here. The course outline is a file that describes extensively what this course is about. So here is an example. You can see that you can find there the course name, who is the instructor or the instructors of this course, how you can contact them, at what time the course is delivered, and going further down, I'm not going to bore you by going through all the pages, you will be able to find information about the books you have to study, about your exams, how your grade is calculated. So make sure that you read the course outline for your courses. They will give you a lot of information. Now, once we have finished with these formalities, let's go and see how online courses happen, how they are delivered. Once you go into Moodle, you will see that there will be a link that you have to click to be directed to the online course page. So by clicking where it says online session, you will be sent to another program that is called Blackboard Collaborate. This is a program that we use in order to communicate and do teleconferencing. When you run it for the first time, it will make a microphone test, so make sure that this bar, the purple bar, is moving when you are talking and check your microphone. And then you'll have to do a webcam check. Both of these are important in order to communicate with your instructors correctly. Then you have the option to go through a tutorial. The tutorial basically will give you the same information that I will give you right now, but it's a good way to get familiarized with a program interface and what the different icons do. This is the main screen. So once you check your microphone and webcam, this is what you will see. For now, this is empty, no other students have connected, but as more students connect, you will be able to see their windows with their names. On the bottom of the screen, you can see different icons. Now, the icon I'm illustrating right now is the icon that allows you to turn on and off your microphone. When you start, both your microphone and webcam will be turned off. During the lectures or the labs, you might be asked to turn them on to communicate. But make sure that you have not by accident left them on for many reasons. First of all, you don't want to be heard saying things that are not to be broadcasted. But the second is that it might create echo. Even if you don't say anything, just having the sound of your instructor's voice going through your computer will create echo that causes problems for the lectures. Now, that's the second button that turns on and off your webcam. As soon as you turn it on, you'll be able to see a small screen with your face. And this is also a very important icon. When you click it, you are able to raise or lower your hand. When you raise your hand, this will appear on your instructor screen, and it's a cue, it's an indication that you want either to talk or you're ready to answer a question. So this is your way to interact without using your microphone, because you realize that having 100 students wanting to talk at the same time will create a little bit of a chaos. Now on the right side, this purple double arrow icon is the Collaborate panel. When you click there, you will open up initially the chat box. This is another way to communicate. You can write whatever you want and it will be broadcast to everyone that is present in the course. This is a little bit an idea of how you will be able to see your lecture. In the main screen, you are going to see the slides being presented by your instructor. You will be able to hear your instructor's voice. And on the right side, you will have the chat box where messages can be exchanged. Now, if your instructor asks you to raise your hand, you click on this icon, you see that it becomes purple, and automatically we know that you are there. This can be used, for example, to check attendance. We might want to be sure that you are there, you have not just left your computer on, so your instructor might tell you to raise your hands, to take attendance, or verify that you're there. Everything we write can be seen on the right side of the screen. So if your instructor wants to write something, give you a link or any piece of information, he will type it there and you're able to see it on the right side on the text box. Another way that we can ask you to interact is by putting polls or questions. During the lecture or the lab, your instructor might tell you that he's going to ask a question or put up a poll option, like in this case. This will be a question with different options that you have to click. So by clicking, you can choose the right answer for a pop quiz or anything else that your instructor chooses to make you interact with them. Now let's see some basic rules. When we have an online lecture, the first thing is that this is not a Facebook window, this is not something that you want to use to chat with other students. Whenever you send a message, it will be broadcast to everybody and it will disrupt. So please do not chat with other students through the chat box or using your microphone. When you have to use the chat box, again, everything is broadcast. So this is not something you want to use for irrelevant comments or write something that is between you and your instructor if you want to send him something personalized. So do not abuse the chat box, please. And as we said, during the lecture, you have to keep both your microphone and your webcam turned off. If everybody turns on their microphones and webcams, the quality of the image will be extremely low, we'll have connection problems, and we'll have also sound echoing. However, we don't want you to stay there and just stare at the screen. We want you to participate, to be able to interact. And this is done with different ways. So the first thing is that when you want to speak, raise your hand. Usually your instructor will have a specific time during the lecture that he can accept or she can accept questions. Other instructors will tell you that at no matter what time during the lecture, you're allowed to ask questions. In both cases, raise your hand by clicking on the corresponding icon and wait for your instructor to give you the word, to tell you to speak. When you want to communicate, turn on both your camera and your microphone. This is very important because we want to be able to see your faces as you are able to see your instructor's face. If, on the other hand, you're really shy, you can use the chat box. But again, we want to urge you to use the microphone and the webcam for communication. Don't forget that part of your grade is for participation. 10% of your grade, that is. Which means that students that actively participate by asking questions, by answering polls, or using their microphone and webcam, they will get a higher participation grade, and you do want that. And now let's go to online labs. How are they done? In order to do your online labs, you will be following again the same links to log on Blackboard Collaborate, so you will be able to communicate with your instructors. However, you must have also accessed before the lab material. You see here that we have it marked as lab plan, and this material, when you click it, will give you very important pieces of information. On the first page, which is standardized for all lab plans, again, you're able to see formalities as the instructor's name, the name of the lab, the topic that you're going to deal with, the lectures that they're going to give you, and also a rotation schedule. This is mainly used in the following years where you come to the university and you have to rotate through different activities. But again, be familiar with that because depending on your team, you will be asked to rotate in different activities and you need to know where you should be at what time. Inside the lab plan, you will see a very detailed description of the activities that you will do. This is an example from anatomy where you have an image with different things we want you to do. It's good for you to have studied that before coming to the lab, because during the lab you will be asked either to answer these questions or show these landmarks, for example, in anatomy that we have asked you to do. So it's not a good thing to come unprepared. Now, how do we behave during these lab activities? As I told you before, we cannot emphasize how important it is to start the lab plans before coming for the labs. Again, this is your chance to actively participate. When we deliver a lecture, you will hear the lecturer, the instructor talking to you, and you'll have very specific points where you can answer. But when you do a lab activity, you'll see that it's much more interactive. You will be asked continuously to participate, to give your feedback. So be ready to do that. Do not be afraid to ask questions. We're there to cover anything that you don't understand. And it's important to ask these questions in front of the class, because they might be subjects that others have not understood correctly, or they also have the same questions, but they're too shy, or they think that it's not significant to ask them. Both for the lectures and the labs, remember that you're here in a university. You need to study smart. These activities are part of your examined material. This means that at the end, you will be asked questions and you will have to pass tests proving that you understood and studied that material. During the labs and the lectures, professors are there for you and they will give you tips on which subjects are more important, what you have to study, and how you can study best. And last but not least, you'll see that the material that is delivered is extensive. It's impossible to memorize everything. So aim for understanding and not memorizing. We have prepared with the IT department an extensive guide for students explaining how you can access your courses on Moodle, how you can do your online labs and lectures, and you can access that at Online Learning Transition Students with the link that you can see on the top of the screen. So if you want more details or you want more information about these two programs, please follow the link and watch the different videos and tutorials that we have prepared. If you have any questions, this is my email, so you can use it to contact me. And just to close this lecture, remember that you have an IT department that you can contact at support.euc.ac.cy. So if you have any problems with your codes, with your emails, or if you cannot connect to your courses, write them an email. They will be there for you. And here is the link for the tutorials and the videos that you can watch in preparation for your first courses. Thank you.
Welcome from me as well. My name is Elias Nikas and my topic today is mock online learning, a practical session. And for the next few minutes, I'm going to demonstrate an online practical session. First, I will briefly talk about independent learning. Then we will have a short case-based discussion together, and I will finish with a demonstration of a team-based learning exercise. Also, I would like to point out that a file like this is shared to you before each practical session in our university, so you are able to prepare on time. Also, I would like to point out that attendance during the labs, also during the lectures, is compulsory in our university. So, first I will start talking about independent learning. And independent learning is an integral part of every lab session in our school. Independent learning could include an exercise or a lab report, as we commonly call it. And this exercise should be sent within a certain deadline. Independent learning could also include filling an online quiz that tests the knowledge acquired through a lecture or a series of lectures. Or it could suggest some YouTube videos to watch and many other stuff according to each different course you attend. Okay, this slide shows you how an online quiz looks like. You can see that some of the questions included in it are accompanied with figures. Also, questions vary from easy to hard to test your knowledge and help you prepare better for your midterm and final examinations. During the second part of today's talk, I'm going to present you two cases. These cases are normally accompanied by discussion during our weekly online lab sessions. And believe me, these discussions could actually last quite long. But before I begin with these two cases, I would like to point out that each case is designed to highlight structure and function correlations, also to integrate various disciplines together, including histology, pathology, anatomy, radiology, microbiology, etc. We believe that this approach is crucial and also helps our students develop high-order thinking skills, not just memorization, as probably some of you have done before. For example, the first slide on the left in this figure shows the normal structure of the thyroid gland, the function of which is to produce thyroid hormones. The second picture shows that the thyroid gland is in fact located in the neck, and it is in close association with the trachea, which is actually the tube located on the center of the figure, and the esophagus, which is the tube located at the back of the figure. The third picture shows the structure of a disease called Hashimoto thyroiditis, in which the abnormal structure is accompanied by abnormal function. Hashimoto thyroiditis is a common cause of hypothyroidism, which is, in fact, it is a hypofunction of the thyroid gland. Last, the fourth picture, as you see this slide here, shows a case of thyroid cancer. And now, let's start with our first case. An 82-year-old female presented to the emergency department where practically, let's say you work, complaining of fever, shortness of breath, and productive cough. During clinical examination, when you examine actually this patient, you heard some abnormal respiratory sound, or rales, as we commonly call them in our field. And you heard these sounds with your stethoscope. You order a chest X-ray, which shows the mass on her right lung. You also order sputum microbiologic examination and blood cultures, and admitted the patient to the hospital because of her condition for antibiotic treatment. However, despite your best efforts, the patient passed away and an autopsy was performed. So, in this slide here, if you compare the chest X-ray of the patient on the left with the normal chest X-ray, as you see on the right part of the figure, you could in fact locate the mass in one of the patient's lungs. This is also the location that you heard the abnormal respiratory sounds, or rales, as I told you before, we prefer to call them, and you heard these sounds with your stethoscope. As we said before, you also ordered a sputum microbiologic examination, which revealed the presence of multiple bacteria, as you can see them pointed with the blue arrows. But as we said before, despite your best efforts, you did the best that you could, your patient passed away. This slide shows the condition of your patient's lung. By scanning the QR code shown on the slide, anyone could in fact study the microscopic appearance of the lung lesion that caused the clinical presentation described before. And I remind you that the patient complained of fever, productive cough, and shortness of breath, while you also heard abnormal breath sounds with your stethoscope. At the top part of both figures, you can see the part of the lung that is structurally normal, while at the bottom, you see that the lung lesion, what we describe right in our example, which looks in fact abnormal, and you can compare it with the normal, which is at the top, and you can figure it out yourselves. It's not a rocket science. As you can see in this figure right here, and you can also check it more thoroughly by scanning the QR code with your cell phone that we provide to you on the screen. Normal lung structure supports its function, which is the gas exchange. And what do we mean by gas exchange? We mean that oxygen enters the body while carbon dioxide exits the body. The white areas in this figure represent the air that is present inside our lungs. And this air produces, actually results in the black color we saw before in the X-ray examination. However, as you can see in this figure here, our lung session appears very different from the normal histology we had in the previous slide. Structure is definitely compromised. It is abnormal. And this mathematically affects the lung function. What we can see in this figure is that the lesion is very cellular. And by cellular, we mean, in this particular case, the cells are mostly inflammatory cells that have invaded this area together with a lot of protein, also dead tissue. And to tell you, this material has prohibited or prohibits the air from coming in our airway spaces as we breathe. So we don't see the air, or if you prefer, we don't see the white spots in histology or the dark spots in the X-ray, as you saw in the X-ray before. And these structural changes caused actually the clinical picture of our patient, that, as we said before, included shortness of breath and productive cough, while the lack of air in the lesion gave a more white color in the chest X-ray, as mentioned before. Right now, you could actually scan the QR code on the screen with your cell phone and select your favorite answer. You can actually do it, you can play with that, and the winner is, anybody guessed it? Pneumonia right here. I hope you understand from this case that it is important to correlate structure and function and also link various disciplines together, such as histology, physiology, microbiology, radiology, etc. Now let's quickly describe our second case. This is about a 56-year-old female that presented to the hospital due to worsening cough, dyspnea, chest pain, and a 10-kilogram weight loss. You were there, and you performed a chest X-ray, or you asked for it, and a CT, and both of them revealed a lung mass in her right lung, and also enlarged lymph nodes in her mediastinum. And mediastinum is the area between the two lungs, and mediastinum contains multiple structures, including our heart. As you worried, though, look at this picture, clinical picture. As you worried quite much with this finding, what you did is to ask for a biopsy. That's what you did. But let's start with the radiology first. In this slide, if you compare the chest X-ray of our patient on the left part of the figure with the normal chest X-ray at the right part of the figure, you could actually locate the lung mass pointed with a red arrow, also some widening of the mediastinum, as you can see with the blue arrows. And in fact, this widening could be caused by the enlarged lymph nodes described in our history. Well, if you check our patient's CT, what you can see is actually this CT showed that the lung mass, with the red arrow, and in addition it confirmed that the enlargement of the mediastinum was in fact caused by an enlarged lymph node, as we actually guessed before. And we can see that pointed with the blue arrow. This particular slide right here shows the biopsy of our patient, which was performed with the help of ultrasound. During this biopsy procedure, it is possible to see the location of the needle and to actually be sure that the needle does, in fact, enter the target you want to take the biopsy from. This slide shows the lung lesion at the center, which is surrounded by normal lung. And you can see the normal lung, you can see it from what we discussed before, and you can locate it by checking these abundant white spot areas as we described before. And this normal lung is located at the periphery of the tissue center. And I repeat again, at the center of this slide, at the center of this, you see actually the mass that is in question. And the higher magnification of this lesion as you can see in this figure, shows that the structure is completely different once more from the normal lung structure we described before, and also it is composed of big and ugly looking cells. Really bad, really ugly, and you know, if something looks bad, most likely it is going to behave bad. So something like microscopic stereotyping. And if you compare with the normal histology as you see in this slide, you can see once more that the normal lung structure has many white spots that represent air that comes in as we breathe. And this normal structure was compromised in our case, as we saw in the previous slides. And what we saw in the previous slides was the presence of big and ugly looking cells, that they look bad and most likely they are going to behave bad. So once more, you can scan the QR code that you see on the screen. You can choose your favorite answer. So what is your diagnosis in this case? I'm waiting for 5 seconds for you. And the winner is, as many of you probably guessed, lung cancer. Once more, I hope you realize now how important it is to correlate structure and function, and also try to integrate various disciplines such as histology, physiology, microbiology, radiology, oncology, etc. It's really crucial to combine all these disciplines together. I cannot emphasize enough. But wait, our case is not finished. Lung biopsy examination also showed that some lung cancer cells had actually invaded their nearby vessels. This finding is crucial because it could explain the enlarged mediastinal lymph node we saw in our case. This lymph node, in fact, proved to be a metastasis from this lung cancer. And this metastasis was caused by these exact cancer cells that you see on this figure, that actually, in fact, entered the vessels and traveled all the way towards the lymph node. And this is the mechanism that caused the metastasis we described before. Let's continue with this case. After 6 months, our patient came again to the hospital for her follow-up. She underwent an examination called PET-CT that you can see in the figure, and this examination normally, what actually it does, it detects areas of high metabolism. And cancer is a disease, in fact, characterized by increased metabolism. Unfortunately for our patient, this examination detected a new metastasis. This time, where? In her right adrenal lung. You can see this metastasis with a red arrow, or if you prefer to call it this way, an area of high metabolism. The red arrow shows an area of high metabolism with the characteristics of cancer, as we said before. And now, the last part of our online practical session is composed of a team-based learning exercise, and in this, in our school, we commonly give you a clinical problem with some questions to be answered. You have to do it. You have to work with your teams, and that's what you do. You typically work together with your team, and you either submit it in a written form or you present it orally in front of your colleagues. That's what you do. And you always have to remember, that's why we do this team-based exercise. You always have to remember that even if you work quite well alone, even if you're really good at it, teamwork can in fact produce miracles. And teamwork is also a skill crucial to develop and master in the health practice of the 21st century. It's really crucial. That's why we try to develop this method in our school. This is all I had to say. I hope you enjoyed it. If you have any questions, please do not hesitate to contact me using the email you see in this slide. So, in conclusion, my young Jedis, let the journey of your studies begin, and thank you very much for your attention.
Okay, hello again. Now we're going to continue with the next and final presentation for today. We're going to deal with, again, 3 different topics. This is a very good number. We're going to talk about why do we need assessments, how your grade is calculated, so how you get pass or a bigger grade for a course in order to advance, and how online exams work. So why do we really need exams? There are different ideas there. Most of us think that exams are there because what doesn't kill us makes us stronger. So we need to test someone, we need to make sure that they're strong enough in order to advance. And you've seen different memes that circulate, like in the old days, school was much more harder, students were having more difficult exams, where nowadays things are just easy as a piece of cake, because you have the internet, you have access to everything, so you don't need to memorize, or you don't need to know the same things. Both these ideas are wrong, and they may lead to different undesired or negative situations. There are people that are afraid of exams, people that get burned out during exams or burned out during preparation. As you realize, when you come to this university, all of the activities are obligatory. You need to attend, you need to participate for the lectures, and the same thing is true for the labs, which means that a large amount of your day will be spent following these activities, because we take attendance, we see who is there and who is not. When you arrive at the date of the exams, if you're not well prepared, it's very easy to be exhausted and not be able to prepare for your exams. And there are even people that have what we call examinophobia, or fear of exams. They get frozen, they feel that they're not ready, they don't remember what they have studied. However, exams are not like that. Exams are there, they're used to measure your improvement. And in general, we don't use only exams. We do what we call a continuous assessment. So an assessment is looking into your evolution, seeing how better you become throughout your studies. In addition, we know that if we cannot correct our mistakes, we cannot improve. So one way of finding where we lack, where we have areas that need improvement, is through assessment. You know that when you train, if you do it on your own and don't have someone with you that can guide you and tell you what is right and what is wrong, the whole process is much more difficult. And last but not least, exams are a proof of qualification. You cannot get a diploma if you cannot prove that you're qualified for that. And especially in our situation in medicine, since you're going to deal with patients' lives, and you're going to make decisions that in some cases decide if your patient lives or dies, we need to be able, and you need to be able, to prove that you have the qualification, that you're certified to practice your profession. So let's think of exams as part of the learning process and not something that is separate from that. Which means that during the semester, you will get more knowledge, you'll get new skills, and at the end, and during the midterm exams, because we have different times where we assess you, you will be able to prove to yourselves and your instructors that you have the knowledge and you have the skills required to advance to the next step. Now, before we proceed, a common question that we get from all our students is, how is my grade calculated? What is the mathematical formula? How do you coin up my grade? How do you know if I'm good enough to pass the course or not good enough and I should repeat it? As I told you in the previous lectures, we have for each course a course outline. Inside the course outline, you can find a very detailed description of how your grade is calculated. So in this case, you can see that 20% of your grade comes from a midterm exam, and remember that all courses have two different exams, a midterm exam that happens in the middle of the semester, and a final exam that takes place after the course has finished. So you have two different chances. There's a different weight to these two, and you'll see that it differs between courses, but in general the midterm exam counts less than the final exam. In this case, we have, for example, 20% of your grade being calculated by your midterm exam, 50% from your final exam. There is a 20% that comes from your assessment in the labs or your assignment. So this is something that is assessed throughout the semester. And we have always a 10% for participation. You remember telling you before that your participation is graded. This is the 10%. And in the end, this makes up for your grade. Now, for the EUC School of Medicine, in order to pass a course, you need to have 60% score. Anything lower than that is considered a failure, and you need to retake the course. If you see, when we do this online assessment, roughly 70% of the grade, or 2/3 of the grade, are based on your exams, the midterm and the final exam, and the rest is through a continuous assessment, which means that even if you don't do as well as you wanted to in a test, you still have the second test, which would be the final, and your continuous assessment that can overpass your lower grade. So don't get discouraged. In the end, remember, you want to be active, you want to participate, you want to show that you're interested in what you do, and prepare continuously from the first day for this assessment. Okay, so the lectures and the labs are online, so we do it from a distance. We have a camera filming me, you have your cameras that will be turned on during your lectures and labs, and we will be able to communicate. But how do we do online exams? Online exams are made and you pass them on your computer, on a computer in general. So we have different types of questions. Mainly you'll have multiple choice questions, and they have a single best answer. So there's always one answer. You don't have to choose 2 out of 3 or being troubled by saying, well, there are more than one option. There's always one correct option. We also give you short answer questions, which means that you might have a question and then you need to type a short answer in the form of a word or a phrase. And both of these questions are organized in an exam that is timed. So you have a specific time in order to pass the exam. All students take the exam at the same time. So we have a program, and you'll know, for example, that next Tuesday at 9 o'clock you have to be in the virtual room where the exam takes place in order to be examined. You cannot take the exam on another day or at your pace, at your leisure. So here's an example. You have your question, you have your options, you need to click which one is the right and then proceed to the next question. But there's still a problem. How can you do online exams by keeping and preserving the exam integrity? You know that the exams are there to test you, and they are different than an assignment. An assignment is when we give you a type of work or something to do at home, which means that you are responsible for doing it on your own. However, an exam is something more official. We need to know that all students follow the same rules. We cannot allow students to have access to the internet or have someone next to them giving them information, or even having someone taking the exam at the place of the student. Because if this happens, it is no longer considered an exam. So in order to have an exam, we need to have the same rules for everybody. And in order to do that, we use online proctoring by the use of your webcams. So let's see what this means. It means that when you are going to pass these exams, you're going to do it at your home, in front of your computers, with the use of your web cameras. There, it's absolutely necessary to have a functioning webcam. You cannot pass the exam if you don't have a webcam or a laptop with a functioning webcam. We use a very specific and specialized program that locks your computer to the exam, which means that during the exam, You cannot exit to look for information online, chat, or do anything else apart from seeing the questions. And during the whole procedure, you are being recorded by your webcam in order to verify that it's you who is taking the exam and no one else interferes with the process. Now we're going to see a small video that explains a little bit how the online exams are running with the use of the program that we have chosen, which is called Respondus Lockdown Browser.
If you're watching this, you're probably required to use Respondus Lockdown Browser for an online exam. Lockdown Browser is a different kind of browser. While taking an exam, you can't print, use other applications, visit other websites, you can't even search the internet for answers. I know, it takes all the fun out of online tests. But here's the good thing, your classmates can't do those things either, so it's just your brain against their brain, a level playing field. Your instructor will provide a link for downloading and installing Lockdown Browser. When you start it, Lockdown Browser might warn you that certain applications have to be shut down before you continue, like screen capture programs, instant messaging, Skype, pretty much anything that lets you communicate with the outside world. You can close those applications yourself or let Lockdown Browser do it for you. The browser will then go to the login page for your online course. Log in like you normally do and locate the exam that requires Lockdown Browser. Remember, after the exam starts, you won't be able to do other things on your computer until you finish the exam. When you're done, just exit Lockdown Browser and you'll be all set. Your instructor might also require you to use a webcam with Lockdown Browser. This part is sometimes called Respondus Monitor, but just think of it as a webcam for Lockdown Browser. The nice thing about the webcam feature is that it lets you take exams from the comfort of your own home, or from the other side of the world. Plus, you can take exams at any time of the day or night. The webcam will record what happens during the exam, and the instructor can review it afterward. So, if an exam requires you to use Lockdown Browser and a webcam, just start Lockdown Browser and locate the exam. Before the exam starts, you'll be guided through a check to make sure your webcam is running properly. Additional steps might also be required by your instructor, such as showing your ID or taking a video of your surrounding area. Once the exam starts, don't give the webcam another thought. Just focus on that test you stayed up all night studying for. When the exam is finished and you submit it for grading, the webcam will shut off automatically. That's pretty much it. Now, take a deep breath and good luck.
Okay, so now let's see a little bit the practicalities of this. How are you going to run the exam from your own computer and what you need to do to be prepared for that? First of all, in the Moodle webpage, you will be given a link where you need to click in order to go to the exam page. Once you click the link, you will see that the exam will be locked and you will need a code to unlock it. This code will be provided by your instructor, and this is to verify that no student will start the exam before the exam time. Once you are given the code and the exam is unlocked and all students start at the same time, you will need to go through a disclosure, you have to read a text that explains that the exam requires you to be recorded, and you need to click yes and give your consent. Since you're going to be recorded, it's absolutely necessary that you accept this. Otherwise, we don't have the right to record you. Once you do that, you will see that at the lowest part of the screen, once you read the disclosure and you accept to proceed with the exam, there's an option to download the program Lockdown Browser. You have to click on that and you will be prompted by Windows or your Mac or even your tablet to install this program. I'm not going to go through this procedure, but you understand that this will be done before the exam. This is why we will give you a mock exam. A mock exam is an exam that you will go through, but it doesn't count. It won't count for your grade. This is done generally a few days before the official exam, So you have the time to set up your computer, test that everything is functioning, and have the time to go through a few questions in order to be prepared for your formal exam. So with this program, Lockdown Browser, installed, you can click on Launch Lockdown Browser and you'll be directed to the exam page. Now we're going to see a second video that goes you through the identification phases of Lockdown Browser. As I told you, you're going to be recorded, but in order to verify that it's you and that there are no means available to you that could bypass what is accepted for an exam, meaning cheating, then you need to go through a certain procedure. And these steps are shown in the following video. Okay, so this video explained how the exams are going to be delivered, and also you can find it at the link that we're going to provide at the end of this presentation, along with a lot of details and tutorials that you can go through in preparation for your online experience. Now, rarely, since we're talking about machines and computers, you know that you might have issues, technical issues. You being disconnected, or your computer crashing, or you having a freeze. When you're using lockdown browser and your computer freezes or you have an issue, you'll be logged inside the exam. You don't have a way to get out. So what do you do in that case? First of all, in most cases, this is just a problem with your internet connection. So by waiting 1 minute, you will see that the exam will resume without any problem. On the rare cases that your computer remains blocked because it crashed, then you have to turn it off and immediately send an email from your computer when you restart it to your instructor, explaining what happened and asking for guidance. He will provide you with information on how to continue with your exam. So don't panic, even in the case that you have a technical issue, we're there to cover you and help you. Here again is the link to all this information we have gathered, so make sure to go through each one of the links that are available there, because it will answer most of the questions you have and it will prepare you for your classes that start, as you know, in 1 week. Now for questions, since you cannot ask me your questions, I'm going to ask a few questions that I received in the past from students, and I'm pretty sure that they're in your head too. So one question that we get is, okay, what happens if I don't want to be recorded during the exam? I don't want to pass this exam online with a webcam. In that case, you're not forced to do it. We need to have your consent in order to do that, but you realize that you will not be able to pass the course. You will need to pass another type of exam, either at the university or after communicating with your instructor. In some cases, this may mean that your course will be considered incomplete until an exam is being offered, accepted, and passed. So, unless you have a very serious reason to do so, we strongly recommend you to pass the online exams and not experiment with the alternative type of exams that we can offer. Now, the second question that comes to mind is that, okay, I'm in front of my computer with my webcam recording me, but how do I know that my colleagues or someone doesn't see it? Is this a cheat-proof system? You're recording me, but I know that my colleague was able to cheat through the exam. The answer to that is that there is no exam that can guarantee 100% that there is no cheating. On the other hand, this is as safe as it can get, because if for some reason the broadcasting is cut, if the image is blocked, and since it's happening in live, in real time, it's pretty difficult to do something without being recorded, this is considered a deviation from normal. So what happens in the case that someone turns off the camera or does any suspicious activity? Then a red flag will be raised for this exam, and the instructor, with a second instructor, will go through the exam in order to assess what is going on. So we will go through the whole exam, the webcam, what you are writing at that time in your computer, and see if there's any suspicious activity. If we find suspicious activity, you will be called to give explanations. And as I told you, it's very important to read the course outline, because in the course outline we are very clearly stating what happens in the case of cheating. So if someone is caught cheating in one of these exams, there are very serious sanctions that can go all the way to being expelled from the school. So you realize that someone might try to cheat, someone might even succeed in doing that, but those people that get caught, and they will be recorded, because we have the recordings, they might be expelled from the school. So again, it's not worth doing it. That's the answer. The last answer that comes to mind, the question, sorry, that comes to mind is, will I be able to go back and forth? What happens if I don't know a question I want to advance? Or what happens if I want to answer first another question and then the other? Well, as the exams are electronic, you all pass the same questions and answers, but the questions and the answers are randomized, which means that if someone is having question number 1, the same question will be question number 40 for someone else, or question number 20 for someone else. And the same thing is true for the answers. The order of the answers is individualized. Everyone will have their own exam. So you are free to go back and forth. You can navigate from question 1 to question 4, 5, and so on, until the time has passed. If you finish your exam before the allocated time, you can submit it and finish. However, once the allocated time for the exam passes, the exam is automatically submitted. Any question you have not answered remains empty, so unanswered. Any question you have already clicked will be deposited and your grade will be automatically calculated. So you see that it's a pretty straightforward process. The advantage, as we said, is that you take it from the safety and the comfort of your home. This reduces a lot of the exam stress, and it allows us to assess you in a safe, reproducible, and also cheat-free way. So these were the things I wanted to discuss with you about your assessment. Again, I remind you that if you have any type of technical problems, feel free to contact our support team, and also go through the tutorials that we have prepared especially for preparation for your online learning experience. Now, once again, I want to welcome you to our school. I want to wish you best of luck for your courses next week. And I'm going to leave you to our Dean, Professor Elizabeth Johnson, for her message. Goodbye.
Well, everyone, you made it through a long week of the new student orientation. All of you, new medical students, new dentistry students, you learned about our program. You learned about what you'll be doing over the next 5 or 6 years. You met your faculty. You met some of your classmates. You met your advisors. You discovered some of the options that you will have in the future. Today is a very long day that you had, that you learned how the remote teaching will be done, how the remote exams will be done, and how the remote laboratories will be done during this period of the COVID pandemic. Of course, we're looking forward to meeting you again very, very soon in the labs, in the lectures. And hopefully this will happen very soon in the near future. Until then, we're making every effort to ensure your safety, but at the same time, the high quality of your educational program. Today is perhaps one of the most important sessions, because this will give you the tools to start your class on Monday. Yes, next Monday, in a few short days, you'll start your program as first-year medical students, as first-year dental students. So the program today is to introduce you to that, so you know how to log in. You heard about Moodle, but how do you log in? How do you see your class? How do you participate? How is your attendance taken? What is a virtual laboratory like? You'll get to experience that today, and then more importantly, you'll get to see what is an assessment like, what is the exam going to be like. Monday is our start, and we believe that throughout this week, we gave you the ability to experience what is coming in the next few years ahead of you. We're all here, we're all waiting for you when the doors open and the COVID pandemic allows us to move freely, so we can welcome you personally to our school. You have received a message from our admissions office and the registrar about the postponement of the white coat ceremony. We saw that a few of you were having difficulties in sending your videotapes, putting on your white coat and saying your oath. It's very important for you to participate in this. The white coat is the commencement. It's the beginning, the matriculation. It is the official start. borrow somebody's white coat, follow the instructions, send us your videotape. The new date, as you've read from your email, is on the 9th. It's extremely important, however, way before then we receive your videos so we can put together the program. Having said that, and looking forward to a very important white coat ceremony with all of you to mark, truly mark the commencement, I want to say a final welcome in closing this orientation program. Welcome to European University Cyprus School of Medicine. Our educational program in dentistry and medicine is ready for you. Monday morning, bright and early, you know that your classes are starting and you know how to get into your courses. We wish you the very best on behalf of the entire family here. You're now our family. But all of us here, faculty, staff, we're waiting for you. And we're ready to give you the journey of your lives, the journey of studying medicine and dentistry. See you on Monday.